Hello, I'm Dr. Ramesh Menon, Associate Director of Genomic Medicine and Personal Genomics Divisions at MedGenome Labs. It's a World Parkinson's Disease Day. So today's topic is Young Onset Parkinson Disease. So typically, people think like Parkinson disease, a disease like Parkinson disease, and will happen after, at an older age, for example, after 60 and all. But in the recent, in the past 10 to 20 years, as the diagnosis has improved, so it is seen also in the younger population, like less than 50 years. So those who have the disease onset of less than 50 years are called a young onset Parkinson disease. Now, as I told, the diagnosis of the Parkinson disease have improved a lot. And one of the main challenge in the diagnosis is like the variety of symptoms. So symptoms, it's highly heterogeneous. Symptoms are highly heterogeneous in the clinic. Clinician, very well experienced clinician can diagnose Parkinson because as I told, it's a highly heterogeneous. And young onset Parkinson disease has more, genetic role. In the recent studies, it is seen like it has more, genetic has a bigger role there than the unknown reasons. So Parkinson disease can be divided mainly into two. One is like familial Parkinson disease. Second is the sporadic disease, Parkinson disease. And the familial, Parkinson disease, it may happen, within the family, like a first degree blood relative or the second degree blood relative may, had the disease and somebody else also will get the onset of the disease. So, and the sporadic is, it's unexplained actually. So there is no, specific reason that we cannot align to a reason that why somebody got a disease. And coming to the genetic part of it, so broadly, the genetic inheritance can be, is accounted till up to you can say like 25% of the disease. So 75% of the Parkinson's disease that happening is unknown. So we don't know why it is happening and everything. So but 25% there is a genetic accountability. Coming to the genetic part of it, there are we can divide into two parts. One is like the monogenic disease, like the causative mutations happening in around 10 to 15 genes, such as LRK2, GBA, Parkin gene, PINK1, etc. So till now the genetic studies have found out 10 to 15 genes causative for that, and in the very recent studies it has been also certain genetic variations, around 90 plus genetic variations have been associated with Parkinson disease. How it happens is like these genetic variations contribute together to the development of the disease, which is not explained by the monogenic or the 10 to 15 genes I was mentioning. Now, MedGenome has conducted a study recently, in collaboration with the PRI consortia. It's a group of hospitals and clinicians across India, and we have found, it was the first study in the South Asian or the Indian population. No? So we have found a genetic loci that is seen, seen in the Indian population. That study was in the young onset Parkinson disease. So we could identify the genetic mutations in the Indian population. And very interestingly, very recent study, that ongoing study that we are engaged in, that shows the genetic mutation and the correlation with the clinical presentation. So as I was telling in the beginning, the symptoms are highly heterogeneous. So we have seen like if people having certain genetic mutation have certain pattern of disease symptoms, so presentation to the clinic. So these kind of clinical phenotype correlation with the genetic, these kind of studies will help the clinician. Is a powerful tool to the clinician for getting the diagnosis at a very early stage of the disease presentation. As a result of all these studies recently conducted by us, so we came up with a very non-invasive test, a very much affordable test that suppose somebody is having a family history of Parkinson's disease, so they can instead of just sitting thinking about will I get disease or not practically. So someone sitting at home can book this test online, and this it requires only the saliva sample. So from that test one can know the risk of the genetic risk of developing Parkinson disease at a very early stage of life, like in 20s and all. And then after knowing it, somebody can consult the clinician or take steps to lifestyle modifications to mitigate the risk of this genetic risk of getting Parkinson disease. So now it is available in India. So I suggest everyone who has the family history of Parkinson disease to go ahead with this test.